All right. Welcome, everybody. I am Steven Martinez, a Chief Marketing Officer for Bobby Brock Insurance, alongside our Director of Go Guru, Will Chapman. And we are joined today by Corey Ashton of Sunfire. And we're going to get into what all Sunfire has to offer, kind of highlight that situation, and just carry on some banter. So should be good. Corey, thank you for joining us.
Yeah. Hey, guys. It's good to see you all.
Awesome.
It's always fun to participate with the Bobby Brock team. So
yes. And so, again, we've been using Sunfire for a long time. It's probably one of our best tools that we use for our agents. It allows our agents to, do the same application process every time. And as insignificant as that may sound, it's very significant when you're, trying to pump out a lot of business, and especially when a busy time like AEP comes around and you're trying to get the most out of that season. Because it's what we all prepare for, and it's a small harvest season. And so Sunfire helps us do some of that. And so we're going to get into, again, some of the highlights and everything that Sunfire has to offer. But I'm sure it's been busy for you with AEP coming up, right?
No, I've just been sitting around at the pool, relaxing. Yeah. I think it's crazy for everyone this time of year. And it just seems to creep up earlier and earlier every year. I don't know if that has become true for you guys, but this is my 14th AEP. And I don't know if I feel like we ever really had downtime this year, which, is a good problem to have. It beats the alternative, right?
Oh, absolutely. It comes around pretty fast. That's for sure. And I know, Will is alongside working with a lot of agents. He's talking to a lot of our agents in our downline. So, a lot of you have had the pleasure of speaking with Will about this. And I wanted Will on here just because he provides a lot of insight on what you're going through as an agent, and, how to overcome these hurdles with technology. And so I thought Will would be a good one to get on the call to add to some of this. But we do have a slideshow that I'm going to go ahead and pull up, and we'll kind of go through this, and it's going to allow Corey to give us some of the highlights of Sunfire along with a visual here. And so give us the sales pitch, Corey. For those of the people, everybody in the group, may not have heard of Sunfire. And so, for the folks out there who haven't heard of Sunfire, what is Sunfire the way that Corey wants to tell us?
Yeah. So thanks for teeing that up. So at our core, we're a Medicare quoting and enrollment platform, right? It's like this one sentence that we can use to say what we do, but it is really such a small piece of the actual services and products that we offer. So our company got started a little over 7 years ago now by these 3 amazing, brilliant men and this team of 17. And they functioned that way, growing this incredible product in this business until a few years ago when our CEO, CFO, actually stepped in. They purchased Sunfire, and their goal was to kind of scale it up. And we definitely have done that. I started at Sunfire in November of 2021. To think about how long it's been, it feels like forever and then no time at all. But
yeah, if you would have asked me, I would have said you've been there longer.
I know. But everybody, I'm almost a senior employee at this point, because we went from 17 employees to over 100.
Oh, wow.
In the last couple years. So it's been amazing to watch the company grow and flourish. But I think what we have retained that makes us really special is we still have that startup mentality and feel. There's no, oh, that's not my job, or, oh, let me hand that off to somebody. We all jump in. We're all really nimble. We kind of have our hands in everything, and we're super innovative. I came from the carrier side, and they built my career up in such an amazing way. So it's no affront to them, but the carrier used to joke they kind of move like the Titanic, right? They're this huge entity, and it just takes time, and we're small. So we get to be quick. And if somebody makes a suggestion or says, oh, you know what, you should do it this way, we're like, yeah, we totally should. And a few days later, we're already working on implementing that. Yeah. And I think it's what makes us special. And it's what I love about being here is we're constantly innovating, constantly looking for what we can do that's new and exciting, that's going to, at the end of the day, make the beneficiary's life better. And we think we can do that by improving the agent experience, right? Because we're all collectively trying to serve the beneficiary. We're really passionate about that. And we think if we can create tools that help the agents do that in a more efficient, compliant manner, then we're doing a service to the whole industry. So that's kind of who we are at our core. We're a little overeager.
Completely agree with you on that. 100% on board with that. And y'all do a fantastic job of doing that too. As I was telling Stephen, like before we started talking on here, the way that Sunfire has come in and made essentially uncomplicated the process of enrolling people and put everything right there in front of you, especially in an age where there's more regulations and things like that than ever. There's more things to learn online than ever. Of course, you can do things through individual portals and stuff like that. But if you have something right there at your fingertips, it's simplifying that process so much. And you know this already because, like you said, you've been there since pretty much the onset of everything. But I will say that this particular program is something that has changed the way that agents look at Medicare and the way that they write it. So again, I mean, it's nothing but hats off to y'all for what y'all are doing over there.
Yeah, and that's the thing is it's already such a great platform. And as you mentioned, you guys are continuing to grow the platform and evolve the platform, add new features and things to that. And so I applaud you guys for that because, like I said, a big part of the growth and the success of what you guys have done is implementing new things and ideas. And like you said, the ability to have that done quickly and move fast on that. I think, again, that speaks volume for, the leadership team over there and how they want to get things done and how they're expediting, helping the agent community once they see that there is a solution that they can provide. So, again, hats off to you guys, but we'll jump into this presentation here. I'm going to go ahead and
you guys have done half of my job for me.
All right.
So
let's wrap it up.
And you can go ahead and jump past this slide. Just
all right.
I think we already understand what the value of Sunfire is, and we kind of hit on that. But what I want to move into, and I think we could sit and do a training and step by step. But I think ultimately at the end of the day, many of you are already using an online enrollment platform. And I think you understand what an application looks like, right? So what we want to talk to you about are some of the things that make Sunfire exciting, some of the new features that we're rolling out, and some of the things that we've had that I think are going to be incredibly relevant during this selling season and, of course, in the future. So something that I wanted to address right off the bat is I know everyone is thinking and worrying about the new CMS regulations. It feels like we've been on this same loop for the last couple of years now. Last year it was call recording. This year it's these lovely disclaimers. But we want to talk about how Sunfire is planning to help you guys stay compliant. So what's really cool is when you log into the Sunfire platform and you hit quote and enroll, when you drop a zip code, it will actually bounce back to you with how many plans and carriers you represent in that specific zip code, right? And as you can see on the other side, I know it's a little small. We'll send some follow-up materials. So if anybody wants to see this in a fashion they can blow up, you can. But there's also a disclaimer. So if you're using our call recording solution, this disclaimer will actually pop up. It's the disclaimer that you need to read along with inserted in there how many partners or how many carriers and plans that you represent in that specific area according to the zip code that you entered. I think this is super exciting because so many agents are concerned about how they're going to hit that requirement, especially within that, 60 seconds, within that first minute. It's almost impossible, right? I would say the only caveat to this is Sunfire is only going to be able to tell you plans that you are contracted with Sunfire to sell, right? We are unfortunately not omnipresent, and we don't know who you sell with outside of the Sunfire universe, but within the Sunfire universe and through your current hierarchy, we'll be able to generate that information. So pretty cool. I think it's going to be really helpful as we get through this AEP with these lovely new compliance.
Mm-hmm. And I can give you a perfect example of why that is awesome. Is last year, when we were reading these disclaimers, they were not there for us to just read. So I had to keep up with the sheet of paper because, after the, 1400th time that you say it, it's pretty much drilled into your head at that point, but you still want to cover all of your bases. So again, having the disclaimer there is great. But then on top of that, Sunfire knowing exactly who you're ready to sell with and knowing exactly who you can write and what you can provide, and Sunfire just putting that there for you. Say, yes, I'm with these particular companies and I can help you with this. It's a huge help. And again, a weight off the mind of the agent.
Yeah. And at the end of the day, that's what we're trying to do. right, is help you be more efficient within your business. So the other thing, and this isn't necessarily new, but I think it's become even more relevant, is that when you do a scope of appointment form in the Sunfire system, you can do it via text, you can do it via email, or obviously if you're face-to-face, you have that functionality as well. But it will actually track when that scope of appointment was signed, so that you can go back and see if your 48 hours has passed and if you are kind of quote unquote in the clear. The Sunfire system will never stop you from proceeding, because we don't know what situation could have changed where, we're not trying to impede the process, but we do want to give you that tool so that you can go back and see when that was signed and make sure.
Maybe you got a paper scope after the fact, right? Or something.
Yeah.
So
like
somebody walks in your front door,
right.
There's always a variety of situations, but we want to make sure we can at least provide you with that resource if you need it.
And that is awesome too. And so there's not like and I'm not like drilling or anything. I'm just curious myself, because it's something we're going to be using heavily this year. So I'm always curious about the new things. Like whenever you're filling out that scope, is it asking you, is this a walk-in, or is this somebody who you have to wait 48 hours for? Is it just globally, this is a 48-hour scope? You can either go for it if they were an inbound call or a walk-in, or you're going to have to wait if this was an outbound call. Is it just default to a 48-hour?
So excellent question. The scope of appointment form is going to be our standard form. And the only element of it that'll be 48 hours is it'll show you when it was signed. So if you need to adhere to that, you can. Okay. If it's not relevant, you can choose to ignore it. But that way you can reference back to that 48-hour timeline if it's relevant to the client that you're speaking with.
Awesome.
Yeah, that's going to be great, because like you said, this is one of the things that's been talked about all year. I'm almost tired of hearing about it, but it's important. It's important. We've got to do it, and stick by what CMS has us as our guidelines. And so big hats off for you guys for getting this in place for AEP this year.
Yeah, good. Thanks. I've been reading all the threads, in the Facebook group. So I try and have some takeaways there, things we need to worry about depending on what everybody else is worrying about.
Right.
All right, so moving into our customer lookup. So this isn't a new feature for us either. We actually rolled this out last AEP, but it is by far my personal favorite. So what this allows you to do is at the very beginning of a quote, you'll actually see the system prompt you for an MBI, a date of birth, and a zip code. If you enter those 3 pieces of information, our system in real time will verify that that MBI is correct with CMS. It'll give you your Part A and B effective dates. It'll tell you if they're eligible for LIS and what level of LIS. And it will also tell you if they're eligible for Medicaid. It's going to show the current plan and the previous plans that they've been enrolled on, so that you can see, let's say you're working with a Medi member, right? You'll be able to see, okay, this person is notorious for changing every 3 months, and I need to make sure that I flag them in my system to follow up with them before that next enrollment window opens for them, right? So it just gives you an incredible amount of information. It'll also pre-fill their address. So if their address is matching what's in the CMS system, it'll pre-fill that into the application for you. It'll also alert you, as you can kind of see, I know it's small, but it says zip code does not match CMS. So what that means is the zip code that you entered when you did that MBI, date of birth, and zip code, it doesn't match what's on record with CMS. This might tell you that they've moved recently and that potentially is an SEP for them, right? So we're using everything that we can to give you a little bit of a story walking into that enrollment up front. And it saves you all that time of having to enter it, and also that human error element where we actually do a 0 versus an O, or versus an O, right? Which I think happens. And so our goal is to eliminate as much as possible any of those requests for information and make sure that these enrollments are actively getting through, and also that you're not enrolling somebody on a plan that they're already enrolled on, right? Because I was an agent for many years before I came to this side of the business, and it never failed. Somebody said to, like, I think I have like a Cigna something or other, and they don't have a Cigna, they have an AARP plan, and you're like, what have you been talking about? And so I think from, like, I've been a field agent, right? And I never had a tool or a resource like this. This is very unique to Sunfire, and I love talking about this because I think it kind of levels the playing field between field agents and call center agents who have historically had access to marks. So I nerd out over this.
Absolutely.
I hope you guys think it's as cool as I do.
Oh, I absolutely do. We had got access to marks a couple of years ago. And that was a game changer for us internally, just because if you're unaware what Marks is like the system that the Medicaid and actually like Medicare are using for all of this information. So like when you call UHC to get the verification, they're logging into their Mark system, right? So if the Mark system is down for them, because that happens, right? They'll be like, oh, your state system's down. Well, it's going to be down for everybody. Like there's nobody that has access to it, because that is the system like everybody is plugging into to get this information. So for every agent to have that available at their fingertips is again, it's a game changer, because it's very powerful to know what plans they've been enrolled in, how many changes they've made this year, if it's been several, right? That kind of gives you an idea. I don't know if I want to even work with this client, right? They change every month. So like, what am I doing here? But again, all this information is very valuable. And prior to this being available, getting this information was a little bit cumbersome, because again, if you didn't have Marks, they're carriers that offer their individual tools, but then you're subject to their process and their wording, the variation in wording that they give you. Humana may refer to their LIS level as one thing, and then UHC refers to it as something else. Again, this gives you a uniform way that you're always seeing that information, so it becomes very natural to you. After 10, 20 enrollments during AEP, it's going to be, you're looking at it, you see that level of Medicaid, and hey, I understand exactly what LIS level 2 is, right? It's not partial or, giving you these weird things. It's always the same unique, uniform values, what I'm getting at, right? So,
and I'm really glad you brought that up, actually, because it will take that Medicaid or that LIS level, and it'll actually funnel that directly into the quote. So as an agent, you don't even really have to know. I mean, you should.
Right? Is it 75%? Is it 100%? Right? It's going to display it.
And when we talk
automatically.
When we talk about this kind of thing, I mean, and like he said, I work with agents a lot, new agents, experienced agents, everything. And earlier on, one of the most complicated parts of Medicare and writing Medicare is understanding this LIS system and understanding who gets what and how they get it and what they qualify for and how much extra help they get with this and all of these other things that are going on. This is twofold. Number one, you don't have to run back and forth between portals, because there are some portals out there where you can key information in, you can get an LIS status real quick, and you can go back and see what's going to work for them, which is, like we were talking about, that's cumbersome and weird and difficult, especially for a new agent that doesn't really know what they're looking for. So another thing that this is going to do for newer agents specifically is it's going to show you that LIS level and exactly what they're eligible to get, which is a huge deal. Shameless plug. If you don't know a lot about the Medicare side of things, we're always happy to train you in Go Guru University. We have the training in there for those things, but this right here pretty much negates that, because if you're putting in the correct information, it's going to populate exactly what they can get. And this looks even more built out from what it was last year. It looks like it's giving you a little bit more than what we had last year on it.
Yeah. And I'll give you guys a little, freebie. We're hoping that in the future we'll be able to use Social Security as well, Social Security number rather than just MBI. It's on our list, and we're hoping that we can accomplish that. No promises, but that's ultimately our goal.
There was another question, one that I get on I wouldn't say a regular basis, but I have heard this question from time to time. There is this little feature that's on that people have heard of that's called Blue Button, that is supposedly connected to Medicare.gov, and it pulls up people's medication list automatically. Is that something that y'all are looking towards in the future, or is that something that you might not be able to get your hands on?
Yeah, so we've explored that historically. It's certainly on our roadmap. Mm-hmm. I think that what I'll say about that, and not to say anything negative about Blue Button, but Sunfire likes to do things that other people aren't already doing.
Okay.
Right. And so everybody kind of has Blue Button. There's multiple people that have access to that. If we roll out a feature like that, I think we would want to have something that's even more advanced, that's even more in the moment, right? And that we have that's unique to us. So I know we're exploring that. I'm excited to see what our team comes up with in the future, because I think it'll be great. But yeah, I'm glad you brought that up, because it's definitely on our radar.
Absolutely. And there's obviously going to be issues with that, because if the medicine cabinet isn't updated, then you're not going to get the information anyway that needs to be correct. So, there are definitely avenues that I'm sure that y'all are going down to get the most effective way to get that done. And I have no doubt that y'all will.
Yeah, thanks. So another little piece of this, if you want to hop over to the next slide, is the Medicaid eligibility. So I know we mentioned on the last tab that it will show you if they have Medicaid, yes or no. in 29 states. It will also allow you to look up their Medicaid level. So instead of just telling you that they have Medicaid, so it'll tell you if they have it in all 50 states. In 29 of them, if you pivot over to the special needs plans, little radio button, I think is the appropriate term here. I don't want to let our tech team down. I'd be like, that button on the left-hand side. But if you pivot over to that, there will be this Medicaid option that pops up at the top of the screen, and you can put in their Medicaid number or their social security number, and it will actually tell you what level of Medicaid they have.
Awesome.
It's one of the states that has that feature, right? And we're constantly trying to grow that state list. As you can imagine, there are some states that have a little bit more technical capability than others. I'm in Idaho. Idaho is not one of the 29 states. We are not always the most tech savvy here in Idaho, so not a shock there. But as we can continue to grow that list, our goal is to eventually have all 50 states that funnel this data in. And then it will actually, the system will automatically filter out plans that don't accept that level of Medicaid. So like, let's say they're full Medicaid or their QMB, right? It'll filter out whatever plans are applicable to their level of Medicaid. And that way, whatever plan you choose, it's going to match their Medicaid status. So we really do try and make this.
You're almost taking all of the thinking out of it for the agent.
Yep.
Right. Like I almost don't even have to think about anything. I'm just doing the data entry, and it's telling me, the directions I need to go in. And then I'm going to use my own discernment of the available plans and present them to the client. So again, it's something that I always do with technology. I always say it to every agent. We do the behind the agency events where we have a lot of people come in there and we kind of teach them what we do. But I tell them, like, my job is to figure out how to make it as easy as possible for the agents. And the easier I can make it for them, the better the agency does and the more success we're going to have overall. And again, I think as an enrollment platform, you guys are doing a wonderful job of accomplishing the same thing.
Thanks. And, I think for our partners too, we really want to focus on how do you bring new people into this business. I have a personal crusade of, bringing young people in and getting new fresh blood. And I think having a system that walks you through the process and makes it, kind of foolproof, right? Then it's easier to onboard. It's easier to grow your teams. It's easier to train new people. I genuinely believe that most new agents really want to do it right. And this, I think, takes some of the pressure off of them. They don't have to worry about, making quite so many mistakes. So.
Definitely.
Well, yeah, we've moved into a new age, right? We're into a new tech age of enrollment. This is not the way that it used to be. A lot of people remember the way that it used to be, and this is not even close to the way that it used to be.
I look around my tubs of formularies and provider directories and enrollment packets, and
Manila file folders.
Right.
Yep, I remember mailing them. There's no room in the trunk for groceries.
It's hard to grow that way. Yeah, it's hard to grow that way. And like I said, with the with the involvement of growing your team and having more agents, comes the evolution of having to provide reports. As an agency owner, you're probably getting some sort of report or running some numbers through your CRM. But a new feature of Sunfire is the agent reporting feature. So tell us about this.
Yeah, I'm really excited about this. This has been piloted throughout the month of August. It'll be releasing this month. So you won't see it if you go run over into your Sunfire this exact moment, but it's coming soon. And you'll definitely see an announcement from us when that's actually live. But it's going to allow the individual agent to go in. We have a little reporting tab on the left-hand side of our Sunfire. It looks like a graph icon. And if they click on it, along the top, they'll see a new performance tab. And it's going to show reports for HRA completion, mail order pharmacy conversion. If they do that, it's going to show how many enrollments they've had this year. It'll show the mix of carriers, who they tend to enroll more with or less. It'll show a little map that gives them an idea of where they tend to do the most of their business. So it's pretty cool. We're really excited about it. Like I said, we've been kind of testing it out this last month. I think eventually we'd like to add a gamification element of it, potentially, where it'll show you how you compare to your fellow colleagues and agents. So just expect more coming down the pipe with this, but this will be available to you guys prior to AEP. So.
Yeah, the gamification is something I think every agent in their agency would appreciate, right? That's something that everybody likes to accomplish. That increases competition within, and that's always good for business.
Yeah.
So I'm excited to see some of that coming down the road.
Yeah, me too. All right. And then I think our other big announcement for the year prior to AEP is that we are rolling out MedSup and dental, vision, and hearing built into the Sunfire platform. Oh, wow. So for those of you who've been using Sunfire, you'll know that we've quoted MedSup in the past, and that's a feature that's been there. But more so than just having it as an afterthought, we're making this a key product within our Sunfire universe. So we do want to kind of set the stage that this is the very first iteration. So you guys are used to, our Medicare Advantage flow, where we've had years and years to perfect and grow and learn and enhance that tool, right? So I just want to set the expectation that we're really excited about this. It has some really cool elements, but we're going to roll it out with a few carriers. We're going to get some of the kinks out, get some feedback, and then we'll just continue to grow this product into 2024. So if you want to hit over to the next slide, we'll talk a little bit about what makes it so special. So what is going to be included in our initial launch is you'll be able to quote for all carriers within the partner footprint. And then we're going to have full enrollment integration with Aetna, Cigna, Anthem, Fallon, and IBX. Mutual of Omaha, I always want to say Moo, and then I feel silly when I say it. Mutual of Omaha, UHC, Humana, and Aflac are planned for next year. There will be some that we have link outs to the carrier portals. Like I said, we're starting with kind of a small, tight group of carriers that we're going to test and see functionality, and then we'll continue to grow that. But what's really neat about this, you guys, and I used to do a lot of MedSup when I was a broker manager, or rather my brokers did, right? And so I talked about MedSup until I was blue in the face. And a lot of it is, guarantee issue versus underwriting, and knowing who's going to accept you and who you're less likely to get that client submitted through, especially if you have to go through underwriting. I think it's been a real challenge. So with our fully integrated partners, and this will continue to expand, we actually will show the agent if that carrier is likely to not accept that beneficiary. So the beginning of the flow will ask some targeted questions surrounding any medications they may be on, any medical conditions that are tied to those medications, and it'll give you a red banner that says, this individual is likely not to be accepted by carrier X, Y, and Z, but you will likely get through underwriting with this carrier. So it just gives an agent kind of a baseline of which direction they should go in, which I think is incredibly helpful. There's nothing more frustrating than spending all the time completing that health assessment and going through the entire experience of a MedSup only to find out that your person is, declined because they just can't make it through underwriting. And then also it'll account for those GI issues. In time, it'll be even more intuitive. But right now, if you put in a GI, it'll go ahead and, of course, skip any of those medical questions that wouldn't be relevant. Right. And then my other favorite element of this is when you do get to the end of a MedSup enrollment, it'll actually prompt you to either go into a DVH policy and or a PDP. So, and any information that you've entered in that MedSup quote and enrollment will just funnel right over. So it makes it really easy to add on some of those other benefit packages that are necessary for that member. And then lastly, I promise I'll stop for our air in a second and you guys can ask me some questions. But lastly, if you get through that flow and you're like, okay, it's red everywhere and none of these carriers are going to accept this person for their medical conditions, they're not going to make it through underwriting, you can just go ahead and pivot right over into our Medicare Advantage and all that data, the drugs, any doctors, any information.
No restarting the application or restarting the quote.
It'll carry right over into that Medicare Advantage flow and then, of course, into the enrollment. So we're really excited about this. And like I said, it's not going to be absolutely everything that we want it to be on the very first iteration. It's our initial launch. So we're going to count on all of our partners to give us feedback and wish list items. We have a laundry list of things we already want to do. But I think the way that we like to behave is just let's get it out there. Let's see what our agents and our partners are really excited about and where they wish we would expand a little more. And then let's use that to kind of formulate our plans. So
that's great. The question that comes to mind, just initially for us, because we have a lot of production in our hierarchy, a lot of agents that do MedSup, a lot of them that do just Medicare Advantage. And then we've had somewhere where they've started mixing that. And sometimes their Medicare Advantage contracts are under a different FMO than their MedSup contracts may be, right? They may be placed in different. So let's just say I have Sunfire available through my Medicare Advantage contracts, right? They're giving me the enrollment too, because primarily that's what it's been used for in the past. But as we make this evolution into MedSup and DVH, say my MedSup contract is somewhere different and I want to submit that enrollment through Sunfire. Am I still getting credit for it? Everything's still in line? Like no issues there, right? It's all tied to my writing number that I'm putting in the system.
Yeah, so that's a really good question, though I would say that I would expand upon your explanation just a little bit. And I would say that you do need to have your ready to sell status, right? And I know it's not the same, like it's a weird term to use for a MedSup, right? But we do need to show who you have enrollment capabilities with on the MedSup side. So if you're not running your MedSup business through the FMO that you are running that you're getting Sunfire through, right? Then we're not going to know you have enrollment capabilities with that carrier. So essentially, if you want to write MedSup in Sunfire, you need to make sure that whoever you're writing your MedSup with gives you access to the Sunfire system.
Okay.
Does that make sense?
Yeah, absolutely.
Yeah, and
otherwise, you won't know that you have enrollment capabilities with them because no one's sending us those files.
Right. So you're not essentially turning on the feature, making it available for enrollment.
Right.
Yeah, I mean, and this is great again for ease of use, obviously, and we could continue to talk about how easy it is to use. Sunfire is simple to use, but another great thing about this is that a lot of people, they know that these, not the MedSup, but like the DVH and other products, they know that they exist, but they're not exactly sure how to transition into them and actually complete that cross sell. This is going to make that a seamless process for them so that they can start to get better at that process and increase that attachment rate, because that's really it's really a game changer for an agency when they can start attaching a dental policy to 30% or 25% of all the policies that they're writing, and you'll start to see that really start to grow the business on a level that you really didn't think you could grow as quickly as you might be able to. And this is a really great add. A question that I have is in the future, and of course, I mean, this is great. Don't expect anything else more than this really, but in the future, is this could you also add capability to write hospital indemnity plans into this as well?
Yeah, that's already on our roadmap as well.
Awesome.
I don't want to set any unrealistic expectations, so I won't give you timing on that quite yet, but that we are knee deep in that as well. So
right, it
Awesome.
seems like the obvious one,
Yeah.
right? With doing all the EMA through here.
I assumed I assumed it was on the radar, so I was just asking.
no, I think that's great, and I'm glad you did. And this is exactly the kind of feedback we're going to be looking for in the coming months. So this will be live by 10/1. I know that not everybody focuses on a whole lot of, MedSup during open enrollment or
We do.
Yeah, good. But we want to hear from you guys. So as you see us in the market, I know we'll be back at Medicare Con next year, and and we're always open to feedback. I know you have a great team at BBI, so if you send them feedback. I do regularly stalk the Facebook group, though I don't interact a whole lot in there. So if you guys have feedback for us, we would love to hear it. Things that you would love to see us. So that way we're sure that we're rowing in the right direction,
Right. You hear that, guys? All things Sunfire, good or bad, put it in the group. Cora's going to see it and she'll move the needle for you. So
I'm not going to respond to you, but
right. She's not going to respond, but she's going to see it and take note of it. So
if I get bombarded by all of you messaging me, I'm going to pretend I didn't see them all. No, I'm just kidding.
Hopefully it's a bombardment of positive messaging.
No, it usually is. And I do look at all of the messages I get, but we try not to. There's one of me and so many of you.
So,
right.
So go ahead.
So these are kind of some things that we like to tout because like I said, and it's actually a perfect lead in, we were just saying we ask for feedback. So these were all things that we heard from our agents and our business partners that we wound up integrating this year. So one of them being our voice signature. So if you are recording your call within the Sunfire platform, you will have the option when you do your scope of appointment or your enrollment form to actually do that voice signature. So if you're not recording your call, you won't see the option. But if you are, you'll get the option to do that text or that email, or of course, in person, but you wouldn't be recording your call if you're in person. And then you'll also see that voice signature option, right? And it'll pop up. And if you click on that, it gives you all the scripting that you need to read in order to be compliant with that voice signature. I think it's really cool. And it helps our people, especially in the scope of appointment space. Even if you do like to do a lot of face-to-face, you can collect those scopes and get that voice recording. I think that's awesome. We also have rolled out a new enrollment flow. So we streamlined it. We got a lot of feedback that maybe we can tweak this a little bit here. You can make this a little bit, tighter or less jumbled or whatever, right? And I will tell you guys, this is a huge, huge thank you to our carrier team, because they have to get that approved by all of our carrier partners, right? And CMS. So it is not an easy feat. Also, when you message me or email me or reach out with, hey, can you change this wording on the enrollment form? And I go, ha, 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 no. It's because I have to get I like to call them the gods of Medicare to approve that one word change so it's not that we don't hear you, but this was a huge undertaking of ours this year. And if you're in the call center version, we reduced that enrollment flow from 9 pages to 5. In our standard environment, it's that same 5 pages. So it's actually aligned across the board, which we think is really cool. Yeah. We have built-in HRAs. We already had built-in HRAs for Anthem, Aetna, UHC, WellCare, and Zing. What I mean by this is if we have some people that are new that are listening, the health risk assessments that the carriers do try and collect, there is a financial element tied to these. I'm assuming that the client is eligible for one of them and it hasn't been completed in the past. So this is obviously something that's beneficial to you as an agent, but also it's really great for the beneficiary. It helps the carrier have an idea of the health and the needs of this Medicare beneficiary that's new to them, that they may not have any records on, and it helps them provide that beneficiary with a customized level of care. A big believer in HRAs as a concept. When they're fully integrated into the Sunfire system, it means that when you're done with that enrollment form, all of the data from the enrollment form will transfer right over into that HRA, and the system will automatically prompt you to complete it. Wow. So really nice. You won't have to re-enter any of that information. Like when we got UHC on, that was incredible because people were having to go over into Lean and log in and re-enter all the information. Like that was, that was like a huge time suck. And then, now we have Humana that's going live actually today. They went live today. And then Cigna will be live by AEP as well. So we're really excited. We think that this will help you guys not only better serve your beneficiaries, but also, put a little bit of extra money in your pocket, which is always nice when those things align.
I know. I always think it's funny how we're mad about it taking 5 minutes to get an extra $75, after everything we do, we're like, oh, I got to go over here and do this. But as insignificant as that was, you guys have made that process even easier, right? So again, kudos to you guys and for having most of the core carriers that you're going to be riding EMAs with during AEP and being able to tack on this extra money that they're throwing at us. Again, it's significant, especially when you're riding, 100 applications or two. Like that extra money every time goes a long way towards additional marketing and reinvestment in your business. So that's pretty big.
I'll get off my soapbox in a minute, but it really does help the carrier. I came from the carrier side. I spent 6 years of my career there, and it really does help the carriers better take care of this member and helps with benefit activation, which at the end of the day, you guys, is stronger retention for you. So there's literally no downside to doing this except for the 5 to 10 minutes of your life, which are absolutely worth it.
Right. Because, what the carriers are doing with this data, they're passing this on to certain managed care teams that they have in place. And if you identify someone with a certain condition or disability, they're going to reach out to them and provide them additional services, which ultimately makes you look better as the agent, that you put them on a plan where, they're being contacted, they're proactively contacting the member and reaching out to them about everything they pretty much told you. Right. They told you all the information. Next thing they know, they're being contacted by the carrier with all of this information. So, you're getting extra money to do it. But on top of that, it's going a long way for your client. It's giving the carrier a leg up on getting more managed care for your client.
Yeah.
And the way things are going, I would really recommend just go ahead and getting in the habit of doing this because it most likely will be required at some point. So go ahead and get in a habit of doing this. As I said, it doesn't take long to do, and it helps the carrier, it helps the client, it helps you. It's a win-win-win all the way around.
Yeah. Cool. Thanks, guys. I'm glad I'm not the only one preaching that.
Oh, no.
And then the last thing is we did expand our pharmacy comparison, and now you can compare more than one pharmacy. So what I mean by this is at the beginning of the flow, you used to be able to pick one pharmacy and it would give you the annual estimated drug costs for that one particular pharmacy. Now you can choose a couple. So if someone says, well, there's a CVS and there's a Walmart by me, you can add both and you could tell them, hey, if you go to Walmart, it's actually going to be X amount less than if you go to CVS and now you're helping your client with their
And
savings.
so this is more along the lines of what Medicare.gov gives us, right? Like when we shop on there.
Yep. So these were all things, like I said, that were requests from our agents and our business partners that we took and we ran with. And so we're really excited to have them on the platform. And I think it just kind of helps tell our story that we really do care what you guys say to us.
Look, you're never going to have to log into Medicare.gov ever again, guys. That is what Sunfire is going to do for you.
I would like to ask you a quick question. You said that you spent a fair amount of time on the carrier side. So I'm curious about this actual process of, and this might be on the next slide and it might be just foreshadowing entirely too much, but as far as networks, as for doctor networks and things like that, as far as the way that carriers update that information, how do they actually, what is the process that they go through of updating that information?
Yeah, so this is actually the last slide. So if you want to take
never mind.
And I'll see each other. But that's an awesome question. And I'm happy to answer it. So the way that we get our data is for anyone who has enrollment capability with us, whether it's a link out, whether it's they're fully integrated, right? We get our information directly from the carrier. So that's the majority of the people that you're going to see on our platform, and the majority of the carriers in the country, they send all of that data to us directly for both providers and also for drugs, right? So I would tell you, you are hard pressed to find a medication that is listed incorrectly in the Sunfire platform. It's very, very straightforward. I got an email the other day actually about this very specific thyroid medication. They're like, oh, gotcha. Like it's not in the Sunfire platform. Well, as it turns out, it's also not on Medicare.gov and it's not in Humana's formulary. So not a Sunfire issue, just a general, for whatever reason, it's not something that Medicare it covers, or maybe it's not approved, whatever that might be, right? But if you find a medication that is listed incorrectly in Sunfire and you can prove it with a screenshot, I will buy you a coffee, because it's pretty rare that ever happens. Now, on the provider side, we get our data once again directly from the carriers. But as you can imagine, they have, so I'll talk from my time at Anthem. On the Anthem website, and this was a comment and things that no matter what carrier you're at, you get questions, comments. Oh, how come this provider that was, that's showing there now is no longer in? Well, they decided they weren't going to be in the network like 3 days ago, right? Yeah. Like they sold their practice that they went and joined. Like it takes time for them to notify the medical group and the medical group to funnel that information on. So there's always going to be a delay in provider data, and it doesn't matter how great you are. For those of you who've been in the industry a long time, you know that this is just the fact. So we get that data from them as regularly as they want to send it. Most of them send it on at least a weekly basis. Some of them send it even more frequently than that. What we've been working on really hard this year is whatever that they're showing on their site is the same thing that's reflecting on ours. So whatever filters they use for their website, we have said, okay, let's use those same filters for the Sunfire data so that when somebody goes and looks at your site and looks at ours, they always match up. Right. So that's been a huge undertaking for our carrier team this year. I think we've come leaps and bounds. I'm never going to blow smoke and tell you that you won't ever find a provider that's showing in network on the carrier site and not on the Sunfire site. But there's just a human element of this, right? Yeah. Where providers have to notify and then the carrier has to update those files that they send to us. So but we
a lot of data that has to be consolidated, and you got right?
And you got a large chain of command. I mean, there's a lot of people with their hands on this information. Anything can get lost when it's going up the chain. So I mean, like you said, there's a human element to this that is not just solely based on one group of people. It's a team effort to keep all of this going, running the way that it runs.
Yeah. And our carrier partners are amazing at getting us that data as quickly as they can. But, it's also them getting that data. And as you can imagine, those reports are massive. So we collect it from them as often as humanly possible. And they're really great about, trying to keep us as relevant as we can be.
Very cool. Thank you.
We did have a comment come in, or a question come in from Mr. Tony Merwin. And he is in the Spanish speaking market. And he asked, when do we get a Spanish interface for customers?
Yeah, he's been hounding me for this one last year. Thanks for putting me on the spot, Tony. No, Tony's actually a great friend, and he came and spoke at our internal Sunfire retreat this last year, and that was something that he brought up. And it has certainly made our roadmap We had some other initiatives that we really had to focus on this year, like our MedSup and dental vision hearing initiatives. But we definitely think there's a space for us to expand into the Spanish speaking. We're going to eventually start on customer facing materials, and then over time would look at trying to have an agent facing Spanish version, because we do know that there are some agents out there that are predominantly Spanish speaking. And so I hesitate to give any kind of timeline on that, but I know it's something that we're talking about. I really hope that it makes it on our roadmap for next year, but continued feedback like this is always helpful. And I'll take this back to the team. Tony knows that I pay attention to him. So
yeah. Well, I'll stay on you about Russian next. So
I'll get right on that.
No, but that is a good point. There are certain niches in the Medicare that we have agencies that are focusing on. So it is always good to take that into consideration, and if it makes sense, then absolutely get it implemented. So
yeah.
Guys, feel free to ask any other questions. I know Corey's has been in. Explained a lot here today. I don't want to keep her too long. She's on the East Coast, and we've got her, late night on a Friday here. So don't want to keep her too late. But if you have any other questions, feel free to ask before we get off of here. Again, we have all of our agents using this platform. And right now, if someone doesn't have this Sunfire platform and you're contracted with Bobby Brock Insurance, we are releasing our own version of Sunfire. So we will have a Bobby Brock Insurance Sunfire account that you have access to. It's actually went live today. And so you actually have the account. You'll probably be emailed your username and password sometime next week, probably Monday morning. I think it's scheduled to go out, but you're going to get emailed your username and password with your access to our Bobby Brock Insurance Sunfire account. So anybody that's in our immediate downline with their Medicare Advantage or prescription drug plans, you will have access to that through us. Again, we'll do a big announcement about that next week. Didn't really talk about it a whole lot today, but again, we'll get into that next week, and you'll have access to our Sunfire edition. And so that's been a big undertaking for us, but we're happy to have that available. And again, that'll be available for this AEP. So you can, if you want to use your Bobby Brock Insurance version of Sunfire, that will be able to happen this AEP.
We're so excited to have you guys too. I know that this has kind of been a long time labor of love for all of us. And we were talking about this back at Medicare Con, and so it's exciting. It's really exciting for it to come to fruition. And we really appreciate the partnership with you guys.
Yes, and we wanted to do this just because, again, we really believe in Sunfire as a platform overall. It's what we have all of our agents using. It's what we encourage everybody to do. And if they tell us they're doing something else, I'm like, you're only hurting yourself. You're doing yourself a disservice. So we did have another question come in. Somebody, Facebook user says, do we have the ability to download their data yet?
Yeah, so that's a great question. We have considered that feature being available within our new agent reporting. I have not seen the actual final version of it yet, so I'm hesitant to answer that solidly one way or the other. But if I'm being transparent, a lot of that comes down to our business partners and how they feel, right? Data is everything. I'm going to say what I have said since the beginning of time, not wearing my Sunfire hat, but as a former agent, I have always suggested that you have a CRM and that you keep your data and that you monitor your data and you own your data, right? Yeah. And I know that you guys offer a CRM that I've heard wonderful things about, and so I'll kick that back over to you to do a little promotion there. Yeah. But I think it's really important that you have a CRM that you store your data in, and you don't rely on any enrollment platform or an Excel spreadsheet. I think as many of us used to use in the past, right, to track your clients.
No, that's exactly right.
Excellent point.
We would suggest the same, right? Use a CRM where you're getting all of this data out, no matter what enrollment platform you're doing, whether you're doing that directly with the carrier, right? You would take all of that data and collect it. And what we encourage everybody to do is command print, right? And save it as a PDF and always like save that confirmation. Well, Sunfire makes that a lot easier, right? As soon as you get done with the enrollment, you can save the PDF of the actual application. And same thing with the scope of appointment. You can save the PDF of the scope of appointment, take that data and put it into your CRM, along with all the other client data that you've collected during your fact finding and during the enrollment, right? So now you have a personal collection of all this data, and now you have your own data warehouse. So no matter what platforms you do or don't have access to is not really a problem for you and your business, right? You still have all your list of clients that you can contact and pursue on with. So this is a good question. But yeah, I mean, I think there's ways around that where it doesn't become an issue for sure.
And one thing to piggyback on that, this is one of my favorite features of Sunfire. I love the personal code feature. It is the coolest thing, because if you have a beneficiary you're talking to, and you got a list of 15 drugs that you have to type in, and then you got a list of 14 doctors that you have to type in, same deal. Grab that personal code, throw it into your CRM, and keep it there. Yep. And all you got to do is repopulate that personal code back into Sunfire, brings up every bit of the information that you had already populated in. It's such a huge time saver. I cannot express to you how important it is to remember and get those personal codes.
And it's if you're using GoGuru Pro as your CRM, it's as easy as just creating a new custom field and having that live there.
Yeah, and what's really cool with those personal codes too is if like you use that personalized URL, the same like Pearl concept that you see with a carrier.
Yeah.
And they're halfway through that process that they swore they could do on their own. And then suddenly they realize there's 28 plans. They are completely overwhelmed, or they have no idea what an SEP is. And they call you freaking out. You can ask them for that personal code at the top and drop it into your Sunfire on the back end. And it'll pull up everything they've already entered, and anything that, like, let's say they started the enrollment form, it'll pull that up too, and it'll let you just take over from there.
That's awesome.
Yeah, really, really cool. I should add that to my slides in the future because I nerd out about that. I think that's a great tool. Like, everybody at Sunfire is either a Medicare nerd or a technology nerd or a combination of both. Like, you should see our company retreats where just a bunch of human beings. But
part of who we are.
Yeah, I mean, just one way that you could use that, right? If you wanted to send the code, send the link out to clients and say, hey, prior to AEP, I need to collect your doctors, your drugs, and your pharmacy. Fill this application out till you get to that point. Once you get to that point, stop and give me that code. I'm going to pick up and do the rest of it for you. But you're essentially putting a little bit of responsibility on the client and making them do a little bit of legwork for you. Maybe your younger ones can accomplish that. But
prompts them, it really walks them through, like, click here to enter, click there to enter. So if you have somebody that's even the slightest bit tech savvy, I highly recommend. I always tell our agents, anybody you have an email for, I would send that personalized URL out on 10-1 and tell them to go follow those steps. If they don't, that's fine. But if they do, you've now eliminated some of the work for yourself. And I think that's awesome.
Yeah, and remember, your 75-year-old people now are not the same 65-year-old people they were 10 years ago. They've been working in a workplace for the last decade, working with technology. So our beneficiaries are getting much better at this. I mean, obviously, they're not where everything's perfect, but it is getting better. So, like Steven said, don't be afraid to ask your clients to do certain things. Some will, some won't. It's just the way that it is. But the more that you can get them to help you out, the easier your job is going to be, and the more accurate the data is going to be too.
Yeah, I was scheduled to be at an event earlier this year that I didn't get to make, and my speech was going to be that your Medicare beneficiary is younger.
Yeah.
And it was all just about in the spirit of how evolved a Medicare beneficiary is now, as opposed to they was 10 years ago. To your point,
they didn't have they don't have a choice. They have to work in technology now. It's part of the workplace. So they are getting younger. They're getting more tech savvy, and it is getting easier to talk to them about these kinds of things.
Well, and their kids who are helping them.
That's true.
Like me, right? My parents in their early 60s, they're not on Medicare yet. I will start taking bribes now for whoever wants to enroll them. I'm totally kidding. I'm going to enroll them myself, obviously. But I'm 35. My parents are in their early 60s, so I won't even be 40 by the time they turn 60. And obviously, I'm tech savvy. I'm going to look for, if I'm helping my parent enroll, I'm going to look for a tool like this. I'm going to look for a resource. I'm going to be online. I'm going to Google reviews on agents, right? I'm going to be interacting in a digital environment. So I think it's really important to keep in mind, it's not just your client that you're playing into, it's their support system. And that support system is definitely tech savvy and definitely looking to be operating in a digital capacity. So, you're doing yourself a disservice if you're not figuring out how to adapt, right? Which, this business is a whole lot of adapting.
Yep.
Justin says it a lot, right? The ability to adapt is going to determine whether or not you're going to be successful or not. So
I think in most things, but especially in our business where, I always think of that little friend scene where like pivot, like all of the time.
Yeah.
That's absolutely right. You mentioned it earlier. The bigger the ship, the harder it is to turn it. So you have to be maneuverable. You can't just plug along. There's going to have to be some change, and that's just the way that it is moving forward. Let's see what we got there. We got another question that came in.
Not sure it was a question as much as it was a statement, but so I'm not going to keep you any longer, Corey. Thank you for joining us. Appreciate all the insight and new features that you've been able to talk about today. It's been a pleasure talking to you as always. And for anybody who doesn't have Sunfire, reach out to us. We'll make sure we get you contracted and get you Sunfire before AEP kicks off. It's not far away. So if you're going to do it, let's get to moving.
Awesome. Thanks, guys. It was good to see you all.
Good to see you too. Thank you so much.